Welcome to the Louisiana HIMSS podcast. HIMSS is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana HIMSS. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LA HIMSS, that's LAHIMSS, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana HIMSS on YouTube. And finally, be sure to stay connected with us at louisiana.hims, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana HIMSS on LinkedIn and LA HIMSS on Twitter. Hello, everyone, and welcome to the Louisiana HIMSS podcast. We are going to be speaking with Amy TRAINOR today. She is the VP and CIO at Ochsner Health System based in New Orleans, Louisiana. Hi, Amy.
Hey, Sydney. Thanks for having me today.
Absolutely. Today, we are going to be talking a little bit about culture and agile transformation. So, Amy, just curious, you've been in your role now for not quite a year. Has it really flown by for you?
It has. It's been so much fun. Honestly, I really have enjoyed just learning new things. I've been doing the clinical side of the house for quite some time. So really expanding and learning more about technology and analytics and AI and cyber have been really just a lot of fun for me. So really excited. It has flown by. Cannot believe it's almost been a year.
Well, I know some of the things that you've been working really hard on over this last year is culture, for one. First off, I can't imagine that most people listening to this don't know who Ochsner Health System is, but can you tell us a little bit about just who Ochsner Health System is and some of y'all's core values?
Absolutely. So largest employer in the state of Louisiana. We are really proud about that. We have about 42 hospitals that we support across Louisiana, Mississippi, Alabama. We actually have one hospital in Texas on our instance of Epic, as well as some clinics all over the country serving our 65 plus organization. We have a ton of clinics and a ton of hospitals. We, from a technology perspective, have spent the last 11 or so years really integrating and making sure that all of our facilities are on the same electronic health record as well as other standard systems. So really excited this last year to really focus on us and how we can be more efficient. What kind of culture do we want to create at our organization, specifically in IS? I know IS is different. We call IS information technology, information services, because one of our guiding principles is that we are accountable and we deliver a service to others. So really making sure we define ourselves in that way, externally as well as internally. As far as like guiding principles and core values, our mission is really to serve, heal, lead, educate, and innovate. Really exciting organizationally that innovate is in our mission, right? Like in our mission statement. But as far as IS goes, and I don't know if you have heard this, I talk about this a lot. We have some pretty firm guiding principles that really do drive our culture and our strategy within IS. And the reason why we have principles is to really make sure our team feels empowered to make decisions, to know what tool set can we give them to take that out, work with our end users and make good decisions. So one of them is like our patients first, right? Like patients first, always. We're always going to build solutions that are going to keep our patients first. We give our clinicians time to care. That's another one. How do we make sure that we're focused on the right things to give our clinicians and physicians time back at the bedside with patients or in the clinic speaking to patients versus documenting in the computer? We believe in a single source of truth. We care about that a whole lot. We also consider accountability and service in our guiding principles as well. There's a lot of them. I could probably do a whole podcast on that, but those are a few that just come to mind as really making us unique, but also making sure our employees every day know that these are things that we teach them. We talk about them, why they're important, and they get to take that and share that as they grow at Ochsner NIS as well.
Love that. I love giving the clinicians the opportunity to sort of be person to person at the bedside instead of, heads down in a computer.
Yes. Yeah. A lot of our organizational goals, I'm not sure if all organizations do this, but I'd say Ochsner in particular cares a lot about this and ease of use, as we call it, or ease of practice. And that's part of our goals for the year, not just in IS, but organizationally. Is like, how do we decrease pajama time? Or how do we make sure that nursing documentation is in the top 25th percentile of all Epic customers, so that we keep that on the forefront, not just in IS, but organizationally? How do we make sure we invest in efforts that can help do that? Super important.
So how do some of those core values for the system as a whole translate to IT?
I think serve, maybe we're not healing, but I like to say, me being a clinician has always really made me want to be that translator for those non-clinicians that work in NIS. So making sure that we're explaining to our teams, while it's serve, heal, educate, and innovate. If we take about serve and heal, I think serve is, we do a lot of serving, whether it's community service or really just serving our user group. But the heal piece, you might think is hard to relate to. So what we try to do is make sure when we talk about, like, how do you relate to heal, all of the things that we do around quality or access or any of these things, we relate that back to the mission, right? Like, how do we say, hey, we're going to help our physicians heal by making it easier for use of the system, or we're going to give them the opportunity to give higher quality care by showing them the things they need when they need it with technology. Or I think the one that is near and dear to my heart, but comes to mind is like, how do we make sure that in the event of a downtime of any type, whether it's cyber or network or hurricane or one of those things, that our physicians and clinicians have time to care for patients using technology. I say this a lot. When I started working in tech, let's say 2002, when I did education for EHRs, I would tell my physicians and clinicians, you don't need a computer to take care of a patient. And while that still might be true, that's not comfortable for people anymore. So then it was paper charting, and everybody was like, yeah, the computer's extra work. Now people really do believe that they cannot care as good for patients without technology. So making sure we're bridging that gap, making sure my team knows the impact that a intermittent downtime or a system downtime has on patient care. It's not just an extra anymore. It is a requirement, and it's severely impacting when there's an outage. So really understanding how the mission relates to those types of things, which maybe that you wouldn't be able to relate before, right? Like before it was like, oh, it was computers, that's nice, and this is paper, and that's required. Now we're knowing that some of our nurses have never charted on paper before, probably the vast majority of them, or some of our physicians haven't written a handwritten note. So making sure that we have high reliability and our technology available at all times is probably the thing that I talk about the most, of like why it's so important to patient care. And that really helps us relate back to the mission of serve, heal, lead, educate, and innovate.
Yeah. I also hear you talk about customer service a lot, be delightful.
Yeah, yes. Love to talk about that. I think, we brought this up. It was really interesting. I don't know where I saw it, but yellow is the happiest color. So like statistically proven, science.com or whatever website we found it from, but like statistically the most happy color brings people joy. So really trying to figure out how to infiltrate some maybe traditional technology positions with a little joy, right? Bring a little yellow in their life. So really changing our motto to customer delight, be delightful. We have the little B. I know you probably saw that. Mm-hmm. Really trying to transform the way we interact with our customers and being more proactive than reactive, I would say. That's what that culture shift is about. I'd also say it's really moving more towards like a yes if culture than a no but culture, if that makes sense. Both of those to me are like saying the same exact thing, right? Like at the end of the day, if you say no but or yes if, you're really putting conditions on both, but it feels a lot better to say yes if. So yes, I can do this project if I have these resources, or if I can do it on this timeline, or if the construction is done and completed. Really using these examples to morph that culture of like customer delight, like truly delightful. And I like to tell my team, how many times in your life have you had a delightful experience where you were like, man, that was like delightful? Like, that's a strong word. Like, delightful, good experience, great experience, but delightful is extremely well. Like, you're killing it. You're doing an awesome job. So really challenging the team to do that. And we've done that, our field techs are now wearing yellow shirts. I don't know if you got to see them or not, but we delivered those across the organization. And Darlene, who is our AVP of Customer Delight, really went out and sold the message of like, this is why we're doing this. This is why it's important. We're trying to change the culture. We want to be delightful. We want to deliver delightful service. Our service desk answers the phone and asks people if they are delighted, which sometimes gets people giggly because they're like, wait, what did you say? You're like, yeah, I guess. Like, what do you mean? And so that's really been interesting, but really trying to be that more proactive customer service in that space. And for us here, I don't know if we've ever been in a situation where we could be. We've had a lot of growth over the years, and we've had a lot of things that have put us in a place where we didn't have time to focus on ourselves, and really taking that time now and getting ourselves organized to make sure that we are delivering services that we are proud of, and then that help our customers be delighted.
I love that y'all are calling it out too, because I mean, anytime you're calling the help desk, you're already not having a delightful experience before you even make the phone call. So just calling it out to them and asking them, if they had a delightful experience.
Yeah, I think Darlene really did a great job of making sure that the service desk understood the culture. And honestly, they are the ones that came up with Be Delightful. Like the people that work at the service desk were like, oh, we're bought in. We want to do this. Let's, all be bees for our event that we have every year, Fall Fest. And that to me was just an excellent way to show that they are really bought into what the culture we're trying to create is.
So Ochsner is on a bunch of lists for best places to work, top employers, Newsweek, Forbes, Times-Picayune, Becker's Healthcare, all kinds of places. What for you personally makes Ochsner such a great place to work?
I would say number one is I am from New Orleans. I'm from the New Orleans metro area. The focus on community and helping our community is something that you can't just go to another place and feel, right? Like, I think our mission of making sure that we have a healthy community, our 40 by 30 initiative, which is like to move from 50th to 40th in rankings by the year 2030. That in itself is a real big motivator for me. It's a differentiator, I would say, when we're recruiting, is for people to buy into the mission that we are here to serve the community. We are here to better the health of the state of Louisiana and Mississippi. We are really here to help. While it's that, and I would say working with an innovative group that is bought in of like the mission, specifically in technology, is a game changer. That doesn't happen everywhere, at least where I've worked in the past. That I think you really have to have a special team to say like, hey, we're going to come here and we're going to all do whatever we have to do to make this happen and work. We're going to work together to stand up a COVID unit in the middle of a baseball field to give vaccinations in 2020, where there's no network and no computers, and we're going to do it all digitally. We're not going to use any paper. Like, great example of like just the why behind what we do and how we are diligent on doing things the right way and really breaking down any obstacles that we come across. And that to me is a big differentiator working here. I'd also say organizationally, really a lot of buy-in for the crazy things that I specifically wanted to do the last year around transforming our workspace, making it a community workspace, making it new and different. They organizationally didn't have to be okay with that. I think they were like, do what you need to do to support your team. So we did. We created a really interesting workspace that I would say is pretty unique for definitely organizationally, probably even industry-wide in Louisiana. I think some of Silicon Valley might have some of what we have, but really trying to think differently. And I think they've always encouraged that at Ochsner, trying to help us think differently. We move fast, but make smart decisions. When we need help, ask for it, and we'll get the help that we need. For me, that's been a really big reason why I've been here for 11 years.
So what makes it so unique? What did you change? What did you do?
Yeah. So we are at Benson Towers. So I think you knew this, but we before COVID had about 600 employees at Benson Towers in our IS space. For anybody local who's listening, we are in the old Lord and Taylor. That was in Benson Towers when it used to be a mall. So we had 3 floors, 2 were occupied by IS, and right before COVID, we were adding more cubes, like the month before. So then COVID happened, we went home, and grew as an organization. I would say from 2020 to 2023, added 14 hospitals. Like, that's kind of unheard of, but that's what we did. So our geographic makeup also changed in that time frame, where we couldn't really say we had one singular hub when we have facilities now in Shreveport and Lafayette and Meridian, Mississippi. These are 3 to 6 hour drives to that hub. So both of those things combined, both people moving to work remotely and our geographic makeup changing, really gave us some struggles on like, what do we want to be? How do we want to work in the future? We didn't want to lose what I call SEC, so socialization, education, collaboration. But we wanted to be able to do it in a way that people felt good about when and how they work in person. So last year, around this time, we decided we were going to give up a whole floor of space. We gave it back to the organization. We cleaned out all of those cubes. It was almost like nothing had ever changed. People's calendars were still March of 2020. This is like 2023. Like 2020, March 2020 calendars, coffee mugs still in the right place. Unfortunate for us, we did Katrina style refrigeration and had to like tape up 8 refrigerators that hadn't been touched since 2020. Again, there were things in it from 2023, so we had to tape them all up and throw them all away. But cleaned the space, gave up a floor, took down 50% of the cubes on the floor that we left, and said, we're going to have space that feels good. Like, we're going to have space that encourages socialization, education, collaboration. What we learned quickly is that if you just told people they had to come to the office to sit in a cube and do the same thing that they were doing on their home Zoom, like, why would they do that? Like, I wouldn't do that. I'd be angry about that. So how can we really encourage the time on site to be time that you spend with others, team building or problem solving or, team meetings or one-on-ones, or what are those things that aren't you just moving your Zoom space to a different cube that you could have just done at home? So we took down half the cubes. We made our offices generic. Unless you're there for 3 days or more, you don't have a named office. Unless you're there 3 days or more, you don't have a named cube. We made them all generic. We put on QR codes, and a big shout out to Don Orlando from my team, who really created him and his team. I don't know who on his team did it, but somebody on his team did. Created an opportunity for people to scan if they want to use space. So there's a QR code on each cube. They can also access it remotely. So if they want to come in, they can book space from their office or on a cube. Then they'll know they have it. That was the first step. Then we created Connect Weeks, which is, before we go to Connect Weeks, I'll say we created the social space to be both educational and collaborative with whiteboards and Zoom boards, but also fun with ping pong, Mrs. Pac-Man, putt-putt, and Connect 4. So I would say there are some things that you can do in that space that are not work-related, but really hanging out with your employee, hanging out with your fellow teammates. I do a CIO power hour where I go sit in there and People can come chat or play ping pong with me, but we get to talk and socialize for our lunch period together, and it's really a lot of fun. So we did that, and then we heard from our team that they want to know who else. Now it's not like, can they be in the office? Like, who else is in the office? They want to know if Sydney's going to be there. And they'll come if Sydney's there, but if Sydney's not there, they don't want to go. So the team really, again, just, hit it out the park and really organized a way for not only can we see who's if it's available, but also who else is going to be in the office with me that day. So really encouraging people to do the socialization without a requirement, I would say. This, Sydney, probably better than anybody, is we're not in a market that people are like actively moving to in New Orleans. So how do we recruit and retain the top talent, give them what they want as far as a culture perspective, but also not have that hard hand of like, oh, you have to come to the office every day. And this was the first step to that. I think the next step was really what we call Connect Week. So we have 8 Connect Weeks every year. We give it to all the employees. We'll give it out next month. We say, if you're coming to the office, you come this week and there will be people. Like, everyone is there. It allows our remote employees that are remote, not just driving, but like nationally, to know like, hey, if I want some interaction and collaboration, this is the week I plan it. It allows our leaders to know like, hey, we're going to have people on site. Let's do it that week. We'll have events that week. We try to not make it overly burdened to our planning team by just saying, hey, look, this is the space that's available. You guys as leaders make your agendas on what you want to do, but like, this is the week that we're going to have people on site. That's really helped as well. I believe that there is a lot of loneliness out there that isn't addressed. I think people are comfortable in their home space and it feels good and it's easy and you don't have to drive. But I also think you can sit at your computer at home for 12 to 14 hours. Your activity is very limited, meaning like you get to go walk, a couple of feet to the refrigerator or, a few more feet to the bathroom. But really, like, what is that doing to you to be in that space all the time? I'm not sure if everybody else feels the same way as I do, but I do think it's important to give those opportunities for people to have those interactions that can help with loneliness and lead to depression. Really getting out of their home space every once in a while to interact with others, to me, is like mentally very important.
Mm-hmm. That's your clinician coming out in you.
It is. I can't help it. I honestly, Cindy, like for me, I think like March of 2020, went home, kept a journal the whole time we were doing COVID work. Like I was like journaling, which is like not my thing, but I journaled about all the things that we were doing. I wanted to remember it. My office was like super dark wood, dark walls. So I told my husband, I was like, I got to change this. This is too dark. Like everything's dark in here. We have to remodel. So we remodeled. Everything becomes light, right? Everything is like light color walls and airy and pretty and pink and all
yellow.
These things. Yes, yellow. And we did all that. And I was like, I'm still not real happy here. I like being here, but I miss that interaction. I miss walking by people's cubes and saying hi, asking them about their families. I hate the Zoom back to back, no break, just sitting on Zooms doing the same things over and over again. While I do appreciate a lot of the technology work we do, it does tend to be done better in silo, right? There is coding and building that needs to be done. It's better if you're not interrupted by people. But I do think there's a special place where you have to have a little mix of both. And this is my platform. I like to talk about it a lot because I think it's important and people aren't maybe talking about it as much as they should. Making sure that we're thinking about people in a holistic manner, not just the work that they produce, but like how do we make sure that they are okay mentally and also having a good work environment.
So do you guys, I know you talked about Connect Week, but are there other unique IT cultural, initiatives or traditions that you guys have? Like, I don't know if you want to talk about OshCon.
Oh yes, OshCon. Yes, this is great. So this was our second year of OshCon. OshCon was amazing. Again, shout out to our people development team. Really an opportunity for an internal conference. So bringing our team together. Anybody who has presented nationally over the last year is required to present at OshCon for our staff. We require our staff to come in once every 2 years to OshCon. So like I talked about earlier, we didn't want it to be a hard requirement. Like for Connect Week, we said for leaders, they want to come 4 of 8. So we give them the list, they pick their 4, they can plan, they feel good about it. Same for OshCon. OshCon is for all individual employees, so about 800 people. You can come once every 2 years, but we want you to come once every 2 years in person. What an amazing event. We had a ton of speakers. I think we had about almost 500 attendees. We finished Fall Fest with an award ceremony for our team, but also with our traditional Fall Fest, which is the place that I see the most creativity ever from our team. Fall Fest is like a Halloween costume contest, but like on steroids. So this year the theme was IS Library, and each team had to pick a book or a theme book from the library, and they became that team. We were Wizard of Oz. My team was Wizard of Oz. I was Glinda the Good Witch, which was amazing. But we had the most creative group, and we have judges that come by and award. They do skits and songs and dancing and really next level stuff. So really exciting week and exhausting week, but so much fun. And I think the feedback we've received has been pretty amazing. We're going to keep doing that. Like we're going to try to expand that to our operations counterparts. So I think a lot of people go to conferences and see what other people do, but sometimes they don't get to see what we do because we don't present it to them, right? So how do we do that same type of thing for our operators and give them an opportunity to learn, like, what are we doing at Ochsner for them, and so they can be excited and talk about it as well.
So how are you guys measuring the success of some of these cultural initiatives that you have?
Well, engagement survey, which is going on right now, I would say we care a lot about that organizationally. I personally care a lot about knowing, like, we don't want to be spinning our wheels. Like, if it's not working, tell us, like what do you want? What do you want from a workplace? So that would be one. We also survey every one of these sessions that we do, whether it be Connect Week or one of our summits. So either Clinical Summit or our Technology Summit or OshCon. We really survey to see, like, did you take away something from this? Like, did this add value? Is this helpful? Give us your feedback. If not, we want to hear it. We don't want to be spending our time doing things the team doesn't find value in. I'd say so far, people are finding value in those things. They are really understand. I would say most of our people would say that all of the things we're doing around culture, specifically around education, and we're doing things to help them grow. I think the vast majority said that. I don't remember the percentage, but that they know we're investing in them. And that is of utmost importance to us as we continue to grow and expand our division and do the new cool stuff that's happening out there, like cyber and AI and all of the things that are moving and changing.
So I want to shift a little bit of the conversation towards Agile. I know you guys have been going through this Agile transformation. Can you just walk us through a little bit about what's been happening and where you're at in your journey there?
Absolutely. Agile transformation is not easy. I will say that. For a traditional healthcare shop, probably one of the most difficult things that we've done, other than anybody who's implemented Beaker would understand that Beaker is pretty hard to do. So other than that, I would say Agile transformation is a big culture, but also just the way that you work in the Agile framework is much different than a typical technology person in a healthcare system would work. Where it started was really around what we call journey. So last year in our strategy presentation, as part of our ease of use initiatives, we said we wanted to reorganize our teams to be focused on experiences. So patient experience, clinician experience, physician experience. We do a managed care experience now. We've got, partner experience. How do we, without talking specifically about hierarchy, let's say take hierarchy out of the mix, how do we create a multifunctional team that focuses on the experiences that we're trying to deliver? Today, we were pretty platform heavy. If you put in a ticket to the ambulatory team, because you're an ambulatory person, and that person didn't fix it, they would pass it on to the team that would fix it. Versus, how do we look at this experience as a group, no matter what platform team you live on, and try to solve the problem and prioritize the problems that we need to solve? So that was kind of the idea. Lucky for me, we have a product officer, that Adam, who came from an agile organization that was totally bought in as well. So that he had the PMO. We started like creating and educating around the agile framework, creating Scrum Masters. We still have portfolio management because there's plenty of waterfall projects to do, but like, how do we really transform into product managers and Scrum Masters, as well as journey leaders and architects, to create a core team that can focus on road mapping, prioritization, as well as adding the business to it. So like bringing the right business counterparts, bringing the right technology, project, program management to the table, and figure out like, what can we do, as well as like the build teams underneath, the Scrum teams underneath. What can we do to really move that needle? We never felt like it was going to make it faster. Like, a lot of people say, oh, we're going to move to Agile, it's going to make it faster. It can't go much faster than what we were moving change. We were moving change every Wednesday. Like every Wednesday, software update. I think it's too much change for people. And part of doing this Agile transformation is really making sure we're delivering a quality product, and that the changes might not be as fast, but they're very well thought out and very well tested, and people know what to expect. So road mapping 12 to 18 months, knowing that these are the things that are coming out, this is what I can expect. And then when a new project comes up, what needs to stop to get that project in now, or where can that be prioritized amongst the other work? So we have a couple of journeys live. So our managed care journey, which is inclusive of our digital med, our patient journey is kicking off, patient and access. Partner is live. Our next two to go live are physician and clinician, which together are our largest user groups, right? Like, if you think of, other than patient, patient's probably definitely our largest user group, but after patient, physician and clinician have the most requests. So these are going to be really putting us to the test on like, is this going to work for us moving forward? It's our largest user group, probably about 20,000 people, community providers and employed, that fit into either physician or clinician. So really making sure that we are able to do that as we go forward.
So were there some underlying factors that made you guys even want to start to go down this path with Agile, or?
I think it kind of falls into that, like, customer delight, right? Like, really thinking through, if you were a customer and you had to enter a ticket that got passed on to 10 people, like, you'd be aggravated. Like, that's not the experience that we want to deliver. So we knew that we had to start thinking about things less about platforms and more about the experience we were delivering, no matter what app they were using, whether it's Workday, whether it's, like a third-party clinical system that one doctor uses. We need to make sure that we understand that. So I would say that was really the driver, is knowing the experience we were delivering wasn't what we would consider to be our best. So how did we really want to change it and modify that moving forward?
Yeah. So have you guys already seen, some wins or some ROI from some of the areas that you're?
Yeah, I would say the ROI is hard sell, right? Like, it's hard to figure out. The wins are really around the collaboration and the quality product. So I would say we've seen some big wins there. We've seen so much better prioritization by the business, really making sure they understand what are their top threes, what do we need to focus on, and really teaching the teams, when something else comes up, we have to bring that back to the prioritization of like, hey, where does this fit in? Does this go under, is it 4 or is it 2? Because then we got to move 3 down. So that is a organizational culture change. And I can tell you, I've been here for a long time. This is the first time that we've had a list of, hey, these are our different service lines priorities, or these are the things that we are really trying to focus on organizationally. We want you guys to prioritize this. And if you're not working on this, check with me, because you might not be working on the right thing. For the builders, for the teams, the technology teams, that's a hard message to deliver when the same person has been contacting you for years. You're like, hey, I know this is important, but I'm following these priorities. So that's probably been the biggest struggle for us, is making sure everybody feels empowered to say, hey, this is not, well, we're happy to do this, yes, but it's not on our roadmap for the next 6 months, so we're not going to be able to get to it till then. Really making sure, that's a hard message to deliver, and really making sure people feel empowered to do so is been probably our biggest struggle. So we're working on that now. And then, of course, when we have the nursing and the physician ones, or the physician and clinician, those will be a big win, hopefully, for us to be able to manage the number of requests that we receive in those spaces and make sure that our customers are aware. People always say, they just want to know. They don't want to be wondering, when are they going to get that done or not? But just let's tell them and get them informed. And I think the road mapping piece of Agile will be really helpful for that in the future.
So you said it's going down this journey is one of the hardest things that you guys have had. Is there any advice you would give to other?
Alignment is really important, specifically for us. Product management and Scrum Masters is a new thing, right? We had project managers and program managers, but we didn't have Scrum Masters and we didn't have product managers. And understanding and being aligned specifically on my level, in my leader's level, on what is everyone's roles, defining those roles up front, and making sure we're following and reflecting back. So everyone likes the solution is a great example. Everybody in that team, whether it be the journey leader, which is normally an IS leader, a product leader, which is somebody from the product org, the Scrum Master, or the architect, all of those people see a problem and they get excited and they want to make a solution. But it's not all of their roles to solution. So I think making sure we kind of have to go back to that a lot. Hey, this is your role and this is my role. The person who's solutioning is the architect, because they're the technical one. So let's let them do their thing, and let's move the project along. So I think we've had success. Adam and I really have had to work very closely, hand in hand, making sure we're aligned at all times to be able to communicate these messages down to the teams, because everyone's always wondering what everybody else's job is, right? That's typically how it works. Well, I'm the journey leader. Well, what is the product leader doing? Well, I'm the Scrum Master. Well, what is the architect doing? And what is their job and what is my job? So clear definitions up front, but also reinforcement of those as we move forward is of utmost importance.
Yep. Well, any parting words you want to leave us with around either Agile or culture?
Well, no, I'd like to say some great things about the HIMSS, the Louisiana HIMSS.
Please do.
That we're doing this, and I couldn't hope more that we have more engagement from our Louisiana counterparts. I think we've done a lot of work over the last years to grow that. And Sydney, thank you for hosting this podcast for Louisiana HIMSS, but also with Chris and Brian and the whole team, making sure that we're sharing our message and making sure Louisiana's on the map. So I'm always happy to help when it comes to that. I think it's of utmost importance, and really appreciate you having me here.
Yeah, so just on that note, you are a past president for the Louisiana HIMSS chapter. Just kind of curious, what drove you to want to take on that role? And
that's a great question. I wanted to take on that role right after COVID, when I realized how non-standard data was, and how we could actually improve and get better. And I couldn't believe that we were submitting things on paper, or we couldn't decide what was positive or negative during COVID. It was 4 different things that were both positive and negative. And that was really my tipping point of I can't complain. I have to participate and try to make it better. And the fastest way, or the best way I thought I could do that, was really locally in Louisiana and joining our Louisiana HIMSS chapter, and really becoming part of that team, and which is an amazing team who does amazing work all over the state of Louisiana. So that was my tipping point, but then the group was such a great group to work with. I didn't mind jumping into the president role when it was my turn. So I am presenting on Friday at GC3 this week. I don't know if we'll get this out before GC3, but I'm excited to be on a panel with some other CIOs from Louisiana, Mississippi, Alabama. But really, I would say to anybody who's listening, join your chapter, get involved. I mean, it's all volunteer work, but it's for the greater good. So I never regretted it a day so far, and I'm still out there doing podcasts and presentations. So,
well, thank you for that and for giving that speech for everyone to join. Thanks so much for your time today. We really appreciate it, and looking forward to the next one.
Awesome, Sydney. Thanks for having me.
Okay.
Bye.
HIMSS is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana HIMSS. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LA HIMSS, that's LAHIMSS, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana HIMSS on YouTube. And finally, be sure to stay connected with us at louisiana.hims, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana HIMSS on LinkedIn and LA HIMSS on Twitter.